Three, two, one, go.
Good evening, everybody. So, today we have a topic of significant importance because many have asked about it on our chat rooms and on some of the websites um, through our professional websites. Today's topic is on traumatic brain injury. Uh, for more information after the discussion, please feel free to ask questions, and you can go to our tbimedical.com website, which is posted on the chat. tbimedical.com. The topic is about traumatic brain injury. It's a elusive topic. It's a topic that affects millions of people annually, and it affects people to different degrees. There are mild, moderate, and severe types of traumatic brain injury. The severe types are pretty easy to diagnose. It usually is a patient who's had a severe injury to the head. They've ended up in a hospital, either in a coma, had a fracture to the skull, lost consciousness, and had hemorrhage in the brain sometimes. They have also probably have swelling on the brain as per the MRIs or CAT scan. That's a severe type. The moderate type is where they've had a head injury, may have and probably lost consciousness, and were unresponsive for several hours, if not a couple of days. That's a moderate type of traumatic brain injury, and will have some abnormalities on a CAT scan or MRI of the brain. The bigger problem we face in medicine is diagnosing and treating patients with mild traumatic brain injury. Mild traumatic brain injury is a elusive diagnosis. It requires us to be a little bit more aware of what the patient is talking about, and it usually presents itself with a patient who may or may not have lost consciousness at the time of a traumatic event to the head, usually felt lightheaded, dizzy, or some symptoms like that where they had difficulty with focusing and concentration. And many of these symptoms continue to persist in spite of conservative treatment. They persisted for weeks and months. Many of these symptoms were evaluated probably by the patient's own physicians with an MRI or CAT scan of the brain, and for the most part they would get back a diagnosis saying the MRI was normal and you probably just had a concussion as a patient. What is more frustrating for patients is that they have persistent symptoms that affect their life, affect their family situation, and affect their social interactions, but yet they don't seem to have a clear-cut diagnosis as to why these symptoms have persisted. Most of the physicians initially label them with a diagnosis of just a concussion, and then after 6 months or so, they think, and the physicians sometimes start labeling the patient of having anxiety, depression, and psychiatric conditions. This is very frustrating to patients because their family members, especially their spouse, starts disbelieving the symptoms, and this results in marital discord, family discord, and people think that, hey, there's nothing wrong with you, you're just having a psychiatric problem, and why are you having these symptoms? Unfortunately, these patients had to suffer in silence, and they had to suffer for years and years in silence until a few years ago when we were able to identify these patients through a unique, novel imaging study of the brain, a special MRI of the brain called MRI of the brain with diffusion tensor imaging. MRI DTI is a specialized MRI of the brain which looks at the functionality of the brain and the regular anatomy of the brain. A routine MRI looks at the brain through anatomy. A MRI DTI of the brain looks at the brain not only through anatomy but physiology, and shows which parts of the brain are functioning normally and which parts of the brain are not functioning normally. That allows us to cross-reference the patient's symptoms to those areas of the brain that are not functioning normally as per the MRI DTI, to make an inference and determination that whether or not the symptoms are related to a concussion or traumatic brain injury. If it's related to a traumatic brain injury, it is sometimes a breath of fresh air for patients because now they have a diagnosis for their symptoms. They also have the ability to explain to their family members and their spouses that this is not a psychiatric condition, but rather a organic problem of the brain from the head trauma, and they can now get and seek a more appropriate and accurate treatment plan. How do we treat patients with mild traumatic brain injury, which is a significant problem in the United States? We treat them with medications for the symptoms of memory problems, emotional issues, and sometimes even balance disturbances. We also treat them with therapy. Therapy can be for balance therapy if you're imbalanced, cognitive therapy for memory problems, and we can also treat them with some form of confrontational techniques to help reduce their anxiety level when they approach situations that cause anxiety. The third type of treatment that is sometimes beneficial is hyperbaric oxygen therapy. Hyperbaric oxygen therapy is useful for patients with mild traumatic brain injury because it theoretically increases oxygenation to the brain. It is a cylinder that looks like a big hot dog, which you lie down in for about half an hour to 45 minutes with high levels of oxygen, and that allows you to enhance the oxygen in your brain and theoretically improve your brain function. All of these three baskets of treatment, when done, improve the symptoms significantly and improve patients' qualities of life. With regards to the more severe forms of traumatic brain injury, the ones where patients have been in coma and or have significant brain hemorrhage with significant disability afterwards, treatment is usually centered around and focused around the disabilities that are left over. So if a patient has a disability with regards to moving an arm or a limb, physical therapy and prostheses and orthotics are given to that limb to improve the movement. Sometimes patients will need home care to perform personal hygiene activities and activities of daily living in the more severe forms of traumatic brain injury. And that is important to keep in mind when you have friends or family with traumatic brain injury that are more severe as to what their future holds for them. It is unfortunately not a good diagnosis to get if you have severe traumatic brain injury. If you have mild traumatic brain injury, there is hope and light at the end of the tunnel. It requires a physician who's able to diagnose it rapidly and put you on a treatment plan, and it does by all means require a patient who's motivated to participate in treatment. If a patient is motivated to participate in treatment, the chances of recovery are that much better, and patients do that much much more as far as their functionality. So with that, I'm going to hand over the mic to the audience for questions, and we'll try and get through as many as we can.
I've been dating my boyfriend for 2.5 years and recently suffered a more severe TBI. Recently I found that I am getting very depressed and I am absolutely dissatisfied with my boyfriend, though prior to the TBI everything was fine. Do you have any suggestions? Should I be going and getting cognitive therapy?
So this is a typical question we face, where patients with traumatic brain injury have declining social interpersonal skills with their spouses and immediate family members. This is a situation where patients with traumatic brain injury have emotional ups and downs because of their trauma to the brain and scar tissue in the brain, and because of some of the cognitive problems they face and the frustration it creates. How do we overcome those situations? It requires you to, one, definitely participate with outpatient cognitive therapy. Two, it is important to consider outpatient consultation with a neurologist to get medications on board to manage some of the emotional lability or the ups and downs that occurs with traumatic brain injury. There are medications out there that work like a charm. They do have some minor side effects, but once you're over those side effects, those medications work like a charm, and you should do all right. The third thing I would suggest is some form of counseling between the two of you with a third party psychologist so that both parties can understand one another's frustrations that are being created, and you can have a communication bridge that is created between the two of you by a third party that allows you to minimize the arguments and minimize the frustrations. It sounds like you're in a committed relationship, and it's important to go forwards with such relationships. And it's important that you put the effort into these 3 or 4 different aspects of treatment so that you can improve the quality of your life, improve your relationship with your significant other, and therein on a path to recovery.
I got what was diagnosed concussion because of boxing. I was wearing a helmet and gloves. There was a CT scan done immediately, but there was no results found. They just said I needed rest. Since then, however, I've noticed that I've been having random severe events of depersonalization. With these events, I'm getting significant anxiety and will become randomly scared to death from just about anything. Do you have any advice on how I should proceed?
Yes. So depersonalization and fear are provoked by trauma to the temporal lobes of the brain. These are lobes inside the base of the skull, where if traumatized, you'll end up having difficulty with managing stressors in your life. And depersonalization and fear are some of the symptoms that you'll feel. That being said, I would suggest with depersonalization, cognitive therapy would probably not help, but rather psychological desensitization therapy would probably help. So when you talk to a psychologist, talk to them about desensitization therapy. That'll help improve your overall demeanor and the ability to perform your activities with regards to your routine activities, so that you don't get these depersonalization episodes and you don't get sudden anxiety and fear with various unprovoked events.
I was in an accident when I was 16. A TBI was one of my injuries to my frontal lobe, and it put me in a coma for nearly 2 weeks. When I got out of the hospital, I found myself drawn to drugs and cigarettes, so I quickly became an avid user of marijuana and cigarettes, whereas prior it was not. Do you believe that this addiction aspect of me is because of the TBI?
Yeah. So the personality change after your traumatic brain injury, which, given the history that you mentioned of being in a coma for about 2 weeks, puts it in the realm of a significant or severe traumatic brain injury. The issue at hand is it appears that you've probably traumatized parts of your frontal lobe. The CAT scans will most likely show up negative, but an MRI of the brain with diffusion tensor imaging, DTI, and if you have a question of where to get it done, we'll be happy to post where in New York City you can get that done. It's not available everywhere. but that should give you a better answer as to which part of the brain, which I believe from your description is a part of the frontal lobe, which has been traumatized, has resulted in many of the symptoms that you're experiencing with regards to a impulse addiction to smoking and marijuana. This impulsivity, it's called a lack of um, a lack of filter almost, where you've now developed an impulsivity, is classic symptoms of a frontal lobe injury, and that unfortunately is something that needs to be treated and addressed with both cognitive therapy and psychological therapy. But I would suggest you pursue first, through your primary care physician's office, some imaging studies of the brain that include an MRI of the brain with diffusion tensor imaging. Once that demarcates out the area that's traumatized, then you follow up with a cognitive therapy center and a psychology therapy center.
I recently went to the dentist post TBI and they gave me nitrous. That made me significantly dizzy for the next 3 hours and induced a lot of anxiety. I have several follow up dentist appointments in the near future. What should I do?
Yes, so this is a real life issue. Patients with mild to moderate TBI end up having difficulties with um, um many cognitive skill sets. And when they undergo a procedure with general anesthesia or conscious sedation, which is nitrous oxide, uh, they basically, for the most part, 7 out of 10 times or 70% of the time, nothing happens to them. They're okay. But about a third of the time, patients feel protracted amounts of side effects from that sedation that include sleepiness, grogginess, imbalance, dizziness. These are common complaints that have been noted by patients who have had this. So what I suggest is that if you are doing more dental procedures, please talk to your dentist about this issue, and you would probably want to space out the procedures a little bit farther apart. That's one. The other thing you can do is try to do the procedures on a weekend, so that on Friday, if you do it on a Friday and you're not working on a Saturday and Sunday, it allows you the 2 to 3 days to wash out the anesthesia from your system and therefore reduce the impact of all these side effects. It is purely related to your brain injury that has put you at a higher level of susceptibility for side effects from the conscious sedation or nitrous oxide, and I think that is unfortunate. But it's probably important to let your dentist know and to discuss with your dentist a more gradual, phased-in approach to your treatments, and to try to tailor make your treatments to where you do it over the weekends, so that the impact on your life is much less.
I'm 21 months post concussion from a slip and fall. I hit my head on the back. I hit my head, the back of my head, on concrete. I recently went on a road trip with my husband and found that driving brought me an immense amount of anxiety to the point where I was shaking. I used to drive 6, 7, 8 hours with no issues, but recently I can't even go an hour without getting anxiety and having other issues. What should I be doing? Is desensitization something that I should be looking into?
Yes, this is not only do you have post-concussion symptoms, but you also have a PTSD syndrome. But what is odd about your symptoms are that your slip and fall injury caused the TBI, but you're getting PTSD symptoms from a non-similar event like driving. I also think you may be developing, while sitting in the car, you may be developing some lightheadedness and dizziness because you're looking at the environment outside of you, moving past your visual field, and that stimulates parts of your brain, and that can concomitantly stimulate nausea, lightheadedness, and dizziness, and it can give you a sense of fear. One of the several tricks people have tried is desensitization therapy. The other is if you're in a car, is trying to close one eye uh, and watch the external environment, or read a book so that you're looking down at a book rather than looking out at the environment. And that further reduces the anxiety that it provokes if you're not driving. Obviously, you can't read a book while driving, which is not, which is not a good idea. So we'll do one more question and call it an evening. But however, that being said, I know there are many more questions out there. I want to get to all those questions online, so please keep posting. We'll give you detailed answers and links to various treatment options that are out there to help you improve your quality of lives. So one more question, guys.
Uh, Doctor, thank you for all you're doing. I had one question, which is, do you have any explanation for why humidity/rain significantly worsens my TBI symptoms, such as the headaches and general feeling of fatigue? I know I'm not the only one who experiences this.
Right. So let me start by saying that you are not the only one that experiences it. This is probably occurs in about 40% of the people with TBI. Is a symptom that's associated with increased humidity. The problem is, in our ear we have 3 canals inside the ear. These canals are airtight fluid-filled sacs, and these sacs are very sensitive to heightened levels of humidity. The humidity, if for some reason increases in the ambient room, these canals can also expand in with the amount of fluid that's inside there, further stimulating a balance disturbance and fatigue and dizziness. These are called semicircular canals. It is normal for all of us to have that kind of a sensation in high levels of humidity. So that if you had no TBI and you walked out into a very humid environment, the first thing you would feel was the hot, humid air in your face, and you'd feel a sense of tiredness and lethargy because that humidity is stimulating this canal. That's for patients who have had no TBI. The symptoms are further compounded in patients with TBI because they don't have a compensatory mechanism in the brain to suppress these symptoms. Patients who are completely normal and have had no TBI, they can suppress these symptoms by their compensatory mechanism in the brain, whereas patients with TBI cannot suppress those compensatory mechanisms, do not have those compensatory mechanisms to suppress these symptoms. So now, that being said, there are some tricks that people use in high humid environments. When you know that there's a rainstorm coming, or you have high humid environments, they pre-medicate themselves with either Advil or Tylenol. When that happens, that reduces some of the swelling around the inner semicircular canals in the inner ear. They take it for a day or so before the humidity hits the environment in their towns, and they take it till the end of the event passes, because you'll find that in most places you'll have 1 or 2 days where it's very humid, and you pretty much know it's going to be happening in a day or two because it's advertised in the Weather Channel, and you pre-medicate yourself with a little Advil if you have no kidney problems, or Tylenol if you do have kidney problems, once or twice a day beforehand, so that you prevent the intensity of those symptoms. And that usually seems to work in our experience. And there are other forms of treatment which are a little more complicated, which can be done through your primary care physician's office, but definitely this trick seems to work the fastest and easiest. So with that, I will sign off for the day. It was a really interesting discussion with a lot of people on. I'm happy that we're able to get through some of the questions online on the show, and some we'll get after the show. So have a great evening and have a great weekend, everyone.